I welcome you all to another session. As most of you already know, I immigrated from Ghana, West Africa. The dream has always been to become a physician one day, whether in the military or civilian. But marriage made it easier. As you know, currently I'm not in the military. Now, I've always wondered what life would have been if I did not immigrate to the United States, the steps that I would have taken to become a physician in Ghana. Well, to suppress my curiosity, I got in touch with one of my classmates from high school who is currently a doctor. She did send me some clips of which I'll be reacting to in today's video. So the purpose of today's video is just to bring an understanding to myself and to you watching me what it takes to earn a medical degree in Ghana, and also what it takes to earn a medical degree in the United States. It's gonna be a fun video, so stay tuned. Well, if you're new here, my name is Dr. Frederick Acquah. Currently, I'm a second-year internal medicine resident in New Jersey. And my guest today is Dr. Esi Hasford. Let's go.
My name is Dr. Esi Hasford. I am a medical doctor in Ghana. So today we are having a little chit chat about how the medical education in Ghana differs from medical education in the United States. I will just put out a disclaimer that this has nothing to do with my current workplace, and this is definitely not medical advice. So why medicine? I know it's a bit cliche to say that I've always wanted to be a medical doctor, but I have always wanted to be a medical doctor, like all my life since I was a child. And I think it had something to do with me going to the hospital a lot of the time for various reasons, and seeing how doctors interact, seeing how they help people. I always wanted to help people like that. Of course, there were negative aspects of it that I always wanted to, make positive for people. I am just passionate about being a medical doctor.
Well, when it comes to me, getting into the field of medicine had several reasons. The love for medicine stems from my love for science. I did enjoy my science courses, and I've also realized that science has played a big role in shaping the hands of time with regards to humanity. The field of medicine is also a field where intellectual stimulation is well appreciated. It's a field where your ignorance can leave you crippled in a situation where there's you need to decide between life or death with a human being right in front of you. So it's a great field to be part of, and I'm happy where I am.
My favorite course in the university was surgery. I really enjoyed my surgical rotations, and I also enjoyed obstetrics and gynecology, although I know for a fact that I do not want to be an obstetrician or a gynecologist.
That was interesting. When it comes to me in college, I did enjoy physics a lot, and I saw how physics and physiology had things in common. So in med school, physiology was, a big thing for me. And then in medical clinical rotations, I saw that pulmonary medicine was like physiology, which was like physics.
So you can apply into any of the universities: University of Ghana, University of Science and Technology, University of Developmental Studies, University of Cape Coast. You start from level 100. It takes 6 years if you're entering directly from SHS. So it takes 6 years, 6.5 years to complete a medical education. So you start from level 100, 200, 300 with basic sciences, and you need to get good grades throughout. And then level 400 to 600, that's a sort of a 3-year period. You do your clinical years. So clinical years begin with a medical and surgical rotation. So you do medicine for the 6 months and surgery for another 6 months, and then you'd go to your 5th year, which is your second clinical year. You do obstetrics and gynecology and pediatrics, and then you move on to your final year. You do community health and which is public health, and you go back to do medicine and surgery. So those are your 6 years.
To become a doctor, it takes a lot of schooling. In the United States, pre-K, kindergarten, grade 1 through 12, and then you get to go to college, and then from college, medical school, and residency, you get trained, and depending on what subspecialty you want to do, that's when you earn your certification in. Like she said, I guess from SHS you can go directly into medical training, but it would take 6 years. I think there are programs like that in the Caribbean, American approved medical schools in Caribbean. I think there's something like that with the school that I went to, AUA. Here, when it comes to me, I did SHS. I did 2.5 years, almost getting to the end of the 3rd year in Ghana, Winneba Senior High School. At that time, it was Winneba Secondary School. And then I came here into the United States. I had to take this exam, and instead of going to a junior year, I went to senior year. So I did 1 year at Spring Valley High School. Shout out to all my Spring Valley guys watching me today. So after Spring Valley, I went to University at Albany, 4-year program. So that's where I earned my biology degree with Africana Studies as my minor. So after that, I went to med school, and I'm here. More details to come.
It took me longer than that to become a medical doctor because I didn't get in the first time in my level 100 period. So I did a 4-year course in biochemistry, cell and molecular biology, all in the University of Ghana. Then I did my national service for another year, started working even for a while, just about 3 months, and then I applied to the GEM program. So the GEM program is the Graduate Entry Medical Program, and it's a 4.5 year period. It's 4 years, but 4.5 year period. So when you start the GEM program, I started in 2016. So I did 1.5 years of basic sciences, which is a bit more as compared to the 6-year period where you do about 2 or 3 years of basic sciences. Then we joined the mainstreamers in their level 400. So their level 400 is my 2nd year of GEM. So yeah, we joined the mainstreamers and we do the clinical years together. So that's how my journey was. So instead of doing 6.5 years, it took me a bit longer. So 4 years of university, 1 year national service, did a little work in between, and then 4.5 years extra. And here I am.
Yep, and here she is. Well, I also took longer than I should, and it happened this way. I completed college in 2013, summertime. In August, I got married to my lovely wife, Anita. And in that same year, I did a research and I did present in Buffalo. I was told by one of my advisors to apply to one of the Caribbean schools and see how things would go. Well, I did. I got an interview, I got accepted that same year. So I had the option on starting my medical education in 2013. However, since I was newly married, I wanted to enjoy my marriage. So I did take a year off and I started medical school in fall of 2014. I should have been done summer of 2018 because med school should take 4 years. Now, after completing 2 years in the Caribbean, we have to take the boards, USMLE, United States Medical Licensing Exam, Step 1. So I took that exam, and then we come into the United States, and then we rotate, do the clinical rotation for 2 years at the end of that clinical rotation, or before you end, you have to take your step 2 exam. My school did not have clinical rotation spots in New Jersey, and I live in New Jersey with my lovely wife and family, and I did not want to travel to other states to complete my rotation, so I stayed in New Jersey and I had to rotate in New York. It was easier commuting to New York than going to other states. So then I had to wait until clinical rotation slots were open for me to be placed in that rotation to complete. So it did take longer than it should, but the main thing is life is not a race. I'm here. I'm a resident. You have people that travel to different states to get theirs completed in 2 years, but unfortunately they didn't get into residency, and they had to try again. So life is not a rush. Your time will come. You just need to be patient.
To apply to a hospital to work as an intern, we call that house job over here, like I mentioned earlier. So houseman-ship. Here you do general stuff. So houseman-ship, 2 years, you're doing 6 months of obstetrics and gynecology, 6 months of internal medicine, 6 months of surgery, and 6 months of pediatrics. So that's the 2 years. You choose a hospital where you can get specialists to actually train you, after which you become a medical officer after you get your license, of course. So we have the Medical and Dental Council of Ghana, and after the 2 years of housemanship, they would tell you or give you a permanent license. So housemanship, you're working with a provisional license, and you can't really work elsewhere. Like, you're an intern, you're not the boss, you see. But after that, you get a permanent license and you're allowed to work anywhere with a permanent license. So with a permanent license, you become a medical officer, okay? And you're allowed to work, especially in the district, for at least 1 year before you can come back to school to come and specialize. For specialization, you need your certificate. We get an MBCHB certificate, more like an MBBS certificate, okay? Yes. And then you need to have done an extra year outside the main cities, in a district, a remote place somewhere, at least for 1 year before you can be accepted into specialization. And you join the Ghana College of Physicians and Surgeons and choose the areas you want to specialize in. So the specialization is in 2 parts. You have the membership program, and then after the membership program, you move on to the fellowship program. So membership program, you join, maybe you want to specialize in surgery, general surgery, maybe you want to specialize in internal medicine like you're doing, maybe you want to specialize in whatever it is you want to specialize in, pediatrics. Yeah, you do a 3-year membership course. So, and before that, you have to write primaries, as is the case of every medical setting. Like, you have to write exams, go for interview again before you're accepted into the school. So how fast you enter into specialty programs depends on you as an individual, basically. So that's it. You do a 3-year membership program, and then after which you do a fellowship program. So after membership program, you're basically a specialist, but you're not a fellow. And you do, so for things like cardiology and so on and so forth, if you specialize in internal medicine, you're like a general internal medicine person, okay, for the 3 years. Yeah, remember, you're general internal medicine person. But if you want to specialize further in the various divisions like cardiology and neurology and so on and so forth, you have to do the fellowship program and do that for about 3 or 4 years, depending on the specialty. For surgery, for instance, you become a general surgeon after 3 years, and then if you want to branch on to do neurosurgery, genitourinary, like the main specialties, then you do an extra for 3, 4, or 5 years, depending on it. I know in neurosurgery is about 5 years. So that's a whole lot, you see.
Every medical student needs to apply for the match. We apply to hospitals that we wish we work for, or we get our training from. And when we apply, after we've taken our step 1 exam, which is a USMLE exam, step 1, step 2. During my time, we had to take step 2 CK, which is the knowledge part, and step 2 CS, which is the clinical science part. After taking these exams, you get to apply for residency. So depending on what specialty you want to do, if you want to go into surgery, then you apply to the hospitals that you think will be willing to train you in surgery, or internal medicine like what I'm doing. Or you can apply to some preliminary programs that are required for you to specialize in, let's say, anesthesia or PM&R. So when you apply for residency, you get interviews based on your credential, your grades, and what you have. Now, after you've interviewed at the various hospitals, you're given the opportunity to rank the hospitals based on which one you would want to work at. So you can rank them from 1 to, depending on how many interviews you got. Now, the hospitals that interview the candidates, the hospitals also get to rank the candidates as to which one they would prefer to come work in their program. So there's an algorithm where in March of every year there is a match. So then the algorithm pairs the candidate to the hospital. So then in March, people would know which hospitals they match at. So it's called a match, and every med student, prays for this day. You don't want to go to the match or the time comes and you don't earn residency. It does hurt because you have to wait a whole year to apply again and see if you earn a training spot. I got into residency in internal medicine. Internal medicine training is 3 years. Currently, I'm in my second year, I have 1 more year, and I'll be done. When I'm done with the residency, I can either work as a general practitioner in a clinic, outpatient, or I can be a hospitalist. So hospitalists are those that take care of patients when they come in through the emergency room, they're sick, and then we care for them in the hospital from when they came in till they get discharged. That's internal medicine. Now, after 3 years, there are people that want to subspecialize in other fields of internal medicine. So if you want to be a cardiologist, then you have to go to fellowship for cardiology. Now, getting into fellowship is the same idea as getting into residency. There is also a match. Candidates apply to programs where they want to get their training and they get interviewed there. Those programs or the hospital also get your candidate, they rank them, and you get to match at a hospital for your subspecialty training. So cardiology has this number of years, and after that, if you want to subspecialize in that subspecialty, then you can either be an interventional cardiologist, or other subspecialties that they have. Now, if after internal medicine you want to be a nephrologist, you apply for fellowship as a nephrologist, and it takes 2 years, and then you'll be done with that. So you want to do rheumatology. After 3 years of internal medicine, you apply into rheumatology, and then you get trained as a fellow. Infectious disease, the same way. So every subspecialty in medicine, after completing that 3 years, you get to subspecialize if you choose. People apply into family medicine. So family medicine, you're taking care of patients from birth until death. But internal medicine is from 18 years and above. So same idea, family medicine is a 3-year training program. After that 3 years of training, you get to subspecialize if you want to, or you can become a general practitioner. So after the training ends, you take an exam, you take the boards for that specialty, and when you're done, you get licensed. So we are not called residents anymore. After residency, if you don't want to go into fellowship, you become an attendant. If after residency you want to go into fellowship, you go from a resident to a fellow, and then you become an attendant. So an attendant is a fully licensed physician in the United States. In America, after you earn your medical degree, or if you go to a Caribbean school which is approved by the United States, you get MD degree. So it's either an MD degree or a DO degree. All right, so looking at the time, I think we will stop this video here, and we'll continue it in the next session that I have for you. I don't want to drag the video too long, otherwise it gets daunting and boring. So leave the excitement for the next time we meet, and I'll see you in my next video. Shalom.